Here we have a 3D model of the heart.
We are going to identify 2 out of the 3 heart layers of a heart wall. Myocardium, or the muscle layer. Endocardium, the innermost layer.
To determine which side of the heart is the right side, you want to look for the superior vena cava right here, and below this is the inferior vena cava.
Lateral to the inferior vena cava, we have the coronary sinus. On this side, we have the great cardiac vein. Coming down to the apex of the heart, we have the middle cardiac vein and the posterior interventricular artery.
Here we have the interventricular septum that separates the right and the left ventricle.
Here we have the papillary muscles. We have the chordae tendineae, these little strings-like structure. On this right side, we have the right atrium, the right auricle, and the right ventricle. And on this left side, we have the left atrium, left auricle, and left ventricle. In the right atrium, we have the interatrial septum that leads into the interventricular septum and connects with the moderator band to form a V. Right side, number 31, we have the right coronary artery. And down here, number 63, we have the marginal artery. Here we have the pectinate muscles. Down here in the right ventricle, we have the trabeculae carneae. On the top of the heart, we have the base, and on the bottom of the heart, we have the apex. Here at the base, we have the aortic arch. We have the ascending aorta, and this is the pulmonary trunk. On the left side here, at number 29, we have the left coronary artery. On the side, number 49, we have the circumflex artery. And number 50, we have the anterior interventricular artery.
Deoxygenated blood first enters the heart through the superior vena cava, the inferior vena cava, and coronary sinus openings into the right atrium. This then flows through the tricuspid valve. You can see 1, 2, 3 cusps into the right ventricle.
From the right ventricle, the blood then pumps through the pulmonary semilunar valve. From the pulmonary trunk, the blood will exit from the left and right pulmonary arteries, which will then go into the lungs and become oxygenated. Once the blood becomes oxygenated, it will return to the heart from the right and left pulmonary veins into the left atrium, through the bicuspid valve, into the left ventricle. From the left ventricle, the blood will then push through the aortic valve, which will flow through the aorta into the systemic circuit.